Hey, I'm Dr. Malia Swanson. I'm a menopause specialist, and I want to talk to you today about osteoporosis. So, osteoporosis is decreased in your bone mineral density, and this can lead to fractures and brittle bones. And this is a really big deal because 1 in 2 women will have an osteoporotic fracture in their lifetime, usually in their 70s and 80s, but it depends kind of where you start out prior to menopause as to where you end up with your fracture risk. So it can come on earlier than that. And osteoporosis has a sort of pre osteoporosis state called osteopenia. So, if you've had a bone scan, you may have seen that you were in that osteopenia range, which is low bone mineral density, kind of on the way to osteoporosis. Both are really significant because when I think about your quality of life and your health span, I think of osteoporosis. More women will have debilitating disease and die of osteoporotic fractures than they will from breast cancer. So it's a really big deal. So when we talk about osteoporosis in my practice, when a patient is diagnosed, first of all, how are they diagnosed? So I'm ordering a DEXA scan and I tell them, if you're under 65 and you don't have risk factors, let's get a DEXA to see where your bones are at. Or if you do have risk factors, your insurance will pay for it. But if you don't have risk factors and you're under 65, your insurance won't pay for it. We still need to know where your bones are at. So are you willing to pay the $100 and know where your bones are at? And by and large, everybody says, yeah, please tell me where my bones are at now so I know what I need to do in the future. And I would say with my perimenopausal women, I probably have about 10% coming back as osteoporotic, which is really high for me. And it's fascinating because all of these women, if they were just following insurance guidelines, would not have known that for another 15 years till they were 65 years old. And so I just find that fascinating that like we're not supporting women in the perimenopause transition. We're not empowering women to know where their bones are at. So I highly recommend if you haven't had a DEXA, go get a DEXA. But osteoporosis, if you're coming back with your DEXA and it's showing osteoporosis, low bone mineral density, your T score is less than negative 2.5, or if you are premenopausal, we use that Z score. So osteoporosis is when the bones, the minerals in the bones, so that calcium and phosphorus matrix trabecula in the bones are not as thick. And so any sort of tension can cause, instead of a bending and a returning, you get a break. And so, what do we do about osteoporosis? Patients are always like, how can I impact my bone mineral density? So, it's really important to know your bone mineral density kind of reaches its peak in your 20s. So, we're not going to get back to that peak. We just can't. But what we can do is we can increase your bone mineral density and make it stronger than it currently is. So I think that's important to not lose hope and to continue to try to strengthen your bones. So big culprits for making your bones less strong are if you're drinking a lot of alcohol, um, or if you're smoking cigarettes. Those are going to decrease your bone density. Another thing is if you're using a lot of steroids. So if you're sick all the time, or if you have an autoimmune disease and you're having to use steroids all the time, you're going to decrease your bone mineral density. So trying to avoid those things is key. And then making sure you're getting calcium and vitamin D in your food. It's really beneficial if you can get calcium, especially through your food. So fish with the bones in it, like a can of salmon that still has the bones in it and you're eating the bones, or legumes can be really helpful, certain nuts. And then if you're not getting to the 1,200 milligrams of calcium a day, then supplementing. And then vitamin D. We like to see the vitamin D level definitely. I like to get closer to 50 for people with osteoporosis, but definitely above 30 on your vitamin D level. And if you're not getting there, then making sure that you're supplementing vitamin D. So those are some key things to help. And then the big thing, you think about what strengthens bones. So tension, pulling on a bone strengthens it. You'll notice like if maybe you've had an injury or a fracture and then it's thicker in that area because there's been a tension or a break and you get a thickening in that area. Maybe you were hit on your leg and now there's a thickening in that area, a bony growth, and that is often because there was a tension. So bone responds to tension with building up. So we want to put tension on the bone. And how do we do that? We do that by using our muscles. Our muscles pull on the bone. So that means weightlifting. It can mean really any impact exercise. Jumping can be helpful because that puts impact on the bone. But really, we're talking about lifting heavy weights. And while walking is still more beneficial than not walking, it's not going to create a huge impact on your bone mineral density. So if all you can do is walk, then add a weighted vest to your walk. So let's talk about weightlifting. So when we talk about weightlifting, we want to actually build muscle and build bone. And studies show that in order to do that, we have to actually be lifting heavy weight. So if you're doing lightweight with like 15 to 20 reps or even 12 to 20 reps, that is too light. That's more of like a cardio exercise. You're maintaining your muscle, you're getting your blood flowing, but you're not building muscle. You want to be going to the place of exhaustion. So doing 6 to 8 reps where you can maybe do one more after that, but you don't want to be able to do much more than one. And you want to be doing so much weight that to do more reps, you would have to break your form to continue. So you want to be doing good form to the point where you can do 6 to 8 reps without breaking that form. And that's a good challenge. And you don't want to just start off, go to the gym. You've never been to the gym before and now lift that heavy weight. If that's you and you don't feel comfortable in a gym, you don't feel comfortable with weightlifting, which a lot of women don't. I would say the majority of my patients weren't raised in a culture that supported women lifting heavy things, then I would highly recommend seeing a physical trainer, working with someone for a while to get your form down, to build up to where you can lift heavy things in a safe way. And if you're having joint pain, which a lot of women in perimenopause are, or postmenopause, then you need to work with a physical therapist so your joints can handle that heavier weight. Okay, so we've talked about supplementation, nutrition is key, green vegetables that have calcium like broccoli, really important. And then lifting heavy things is really important, avoiding toxins to the bone like alcohol. And then if you are in perimenopause, it's definitely worth considering, do I add estrogen? Because the estrogen withdrawal in perimenopause causes this rapid bone loss in perimenopause. So we see 70% of the bone loss of going through menopause happening in the window right around, in like the 2 years before and the 2 years after the last menstrual period. And then in that 5 year time span, we see 10% bone density loss from the loss of estrogen. So considering estrogen unfortunately is only FDA approved for prevention of osteoporosis. So if you're already in the osteoporosis boat, then someone has probably brought up bisphosphonates for you. Now, bisphosphonates kind of lock in the bone and prevent further deterioration, but they don't truly build the bone in this anabolic way that estrogen does and some of the other medications do. But there's osteoporotic treatment is a place where there is room for improvement and we need more research. And the problem is that while osteoporosis affects women and men, the majority of those that it affects are women. And so it has been under-researched, and we don't have the best treatments we could have yet, but we're working that way. And so a lot of times what my patients will do is we'll work on estrogen plus or minus a bisphosphonate. We do a bisphosphonate for no more than 5 years, and that can be broken up by a drug holiday. There are some risks with bisphosphonates. You can get atypical fractures, and you can also get jaw issues, osteonecrosis of the jaw. The numbers for osteonecrosis of the jaw are about 1 in 100,000 of risk, and then 1 in 1,000 for the atypical fractures. These are usually with longer use of bisphosphonates. So there are risks, but there are definitely benefits for fracture prevention. And then once someone has kind of finished the bisphosphonate course and we're watching their DEXA scans and they're dropping back into that osteoporotic window, then we add on like a Prolia or another teriparatide, another medication to help with increasing their bone density. Now, these medications are tricky because teriparatide really helps more with the spine. So if you're having hip bone density loss, that's not as helpful. And Prolia is a medication that is really wonderful, But when it is stopped or if a dose is missed, there's a rapid increase in fracture risk suddenly. And so we often will add on a bisphosphonate at the end to kind of support um, when a patient's coming off that medication, support their bones in that time. So the art of osteoporosis treatment is beyond the scope of this video because it's something you have to talk about your own personal storyline. Do you have a history of breast cancer? Then we're going to use certain medicines for osteoporosis. Do you have a history of kidney disease or liver disease? We're going to have to use certain medications. But really important to know that estrogen is really key. So as you go through the perimenopause transition, there's a huge bone density loss, and often adding that estrogen back in can be so key to helping in the osteoporosis picture. I think there needs to be more research around could menopause hormone therapy at the perimenopause transition help with patients who are kind of predisposed to osteoporosis or have osteopenia. Okay, let me know your questions around osteoporosis. I would love to support you as you move through your perimenopause transition. I am seeing patients in Colorado as a telemedicine and in person physician.